Okay. Good morning, everybody. It's 9 o'clock. We're going to go ahead and kick things off here. I'd like to thank everyone for attending this month's Industry Hour series on mental health in the construction industry. And in all honesty, I'm not sure we could have timed this topic any better, coming off the grist of a global pandemic and hearing more and more about mental health issues being catapulted to the forefront of mainstream media. So I'd really like to welcome David Cardie and Todd Lacher of Lacher Insurance, who will be presenting on this topic to us this morning. So with that, gentlemen, I'd like to turn the tables over to you. And I would like to remind everyone, if you have a question, by all means, you can type your question in the chat box, or if the opportunity presents itself, you can unmute yourself and politely ask your question. And obviously I will be monitoring the chat boxes. So with that, Dave and Todd, thank you so much for taking time out of your busy schedules to share with us here this morning.
Thanks, Jay. Yes, good to be with you all. Jay, thanks for the invite, the opportunity to talk and bring Lisa and Brian here to share with us this morning. As Jay said, we, Dave and I, are both part of the healthcare and benefits team, advisor team here at Lacher. We are a family-owned, second-generation insurance and risk management firm located here in Souderton, Pennsylvania. We get to work with organizations all over the Northeast and really all over the country. Our good connection to you guys is we get to work with IBEW 126 and IBEW 313. Especially Dave here has worked with them for a good long time. So that's our one good connection point here to you all. So why are two healthcare and benefits advisors wanting to talk about mental health? Increasingly over the last several years, we find ourselves in conversations as we help to manage healthcare and benefits plans, in conversations with employers and with groups like yourself about mental and behavioral health and what's going on in your population. Right? We get to see what's going on from a healthcare perspective in claims, both in the prevalence or how many times people are accessing mental and behavioral health, as well as the cost to healthcare and benefits plans, but really most importantly, the human cost to organizations and to the people. And as Jay said, this timing, really couldn't be better to make sure that we're putting a spotlight on and talking about the impact of mental and behavioral health on each of the people who we interact with, each of the people in our organizations, as we all have gone through a large collective event that has really brought mental and behavioral health to the fore. Before I kick it over to Lisa and Brian, our main desire in bringing this topic to the forefront to you all this morning is to really deliver the message that we really believe strongly that it's important that organizations, that employers have a strategy to engage mental and behavioral health with their people, right? We need to know what to look for. We need to know how to recognize when someone is struggling. We need to know how to connect them to the resources and to the people that can support them, and how to do that quickly and correctly. Let's be honest, most of us are not equipped to do that. We don't know how to do that. But we need to have a strategy as leaders, as organizations, and the people that we serve. So we're very grateful to Lisa and Brian for spending some time with us. They're gonna be sharing with us certainly about the work that they do, but really talking more broadly about mental health and behavioral health in the workplace, and giving you some of that practical information of how we recognize someone who's struggling, how we connect them to resources, and certainly giving us a broader context of their work and what's going on in organizations and with the people that they work with. So I would like to introduce Brian Frailer and Lisa Paskey from PAS, which stands for Personal Assistance Services. They are a next generation EAP provider, and we're really looking forward to working with them more and also hearing from them this morning. So Lisa and Brian, I'm going to kick it over to you now.
Thank you so much, Todd. I appreciate that. Good morning, everybody from St. Louis, Missouri. Thank you all very much for being here to learn more about this very, very important topic and how you can approach this on your work sites, within your organizations. We're not the same people we were 16 months ago, even though our work schedules, we may still be going through the same routines with our work schedules. Those routines have probably changed a little bit, but many of you, if not all of you, were continuing to go to work, where some people were working remotely. So we've all been impacted highly by the recent events. This is going to cause us to experience more impact on our mental wellness. One of the things that I think it is very important to realize is how you define mental health and mental illness. Healthy is when a person is able to function well in their daily life. That can be physical wellness, that can be mental wellness, that can be any kind of wellness. So when we're healthy, we're functioning very well. Mental health, our mental health is always there. So there is going to be days where we're more healthy and less healthy. So that's not necessarily an all or nothing state, meaning I'm always going to have my mental health is always going to be compromised in some way, but, or it's never going to be compromised in some way. Basically, there are just some days where we feel better than others. And again, that's physically and mentally. Where mental illness comes in is when it affects a person's ability to function over a long period of time. So if I am not mentally well, just like if I'm not physically well, if I am not mentally well, I'm not able to focus, I'm not able to concentrate for an extended period of time, it's going to impact my overall functioning. So it makes sense that healthy employees will be able to work safer, be more productive. They have low absenteeism, very good performers, and healthy workplaces allow for individuals that are having less mental healthy days to be responsive. The workplace can be responsive and listen. Recognize and acknowledge achievements is helpful. So let's take a look and see how prevalent some mental health disorders actually really are in the workplace. Over any given year, 18.1% of our population is diagnosed with an anxiety disorder. 6.7% diagnosed with a major depressive disorder, and 3.8% with a substance use disorder. Now, just because someone has this diagnosis doesn't mean that they're not able to function. But if you see how prevalent it is, over 26% of the workforce, or 26% of adults, is diagnosed with some sort of mental health disorder or challenge that could impact their overall well-being. And depression or major depressive disorder is the leading cause of disability worldwide, even more so than heart disease or diabetes, any of those physical functions or those physical ailments. Some additional mental health facts that are common is 1 in 5 individuals experience mental illness. 1 in 25, which is about 25 million individuals, live with a serious mental illness. And the reason we're giving you these facts is so that you can see how it's highly probable that somebody you're working with, somebody you're close to, has some mental health challenges that they manage on a daily basis. Whether they're managing them well every day or not, it is quite possible that a lot of the folks you work with do have these mental health issues. You may even be one of those folks. Not a bad thing. It's just creating more awareness about it and how prevalent it is and how it may come out more when we're under this unprecedented amount of stress that we've been experiencing. Nearly 60% adults with mental illness didn't receive mental health services in the previous year. So what that means is we're doing what we know. and we're doing, we have different coping skills. We have things that we're trying, things that we're doing, and it very well may be working. That's great. We don't want to change anything that's working. But we also don't know if something is not working sometimes until it comes out in our physical behavior. And as I mentioned, more days have been lost or disrupted by mental illness than many other chronic conditions. And in certain industries, improperly managed conditions can also affect employee safety. If we look at the mental health facts in the construction industry specifically, it has the highest suicide rate among men from ages 16 to 64. And the suicide rate does link to mental health. So, and that's the reason we're pointing it out here, is these factors, and also with opioid abuse, any kind of substance abuse does link with mental health, because a lot of times we're using those substances to self-medicate. Suicide, and we're going to talk more about suicide later, but suicide comes about when we're feeling hopeless and helpless and we see no other options and we just want the pain to stop. In a 9-year study of all industries, in construction, trade, and extraction workers were more likely to report drug use in the past month. Is that surprising? Feel free to comment in the chat. No, I'm seeing some heads shake. Marijuana for the construction, trade, and extraction workers, 12.3% versus 7.5. Cocaine, 1.8 versus 0.8. And the non-prescription opioids from 3.4 versus 2.0. The number I really want you to really realize here is that 1 in 5 construction workers struggle with mental health concerns. And does anybody have an idea why? And feel free to answer in the chat. Any idea why you think that is? Well, work schedules are can be very long stretches away from your family, long stretches away from your friends, long stretches away from those that you know and that who are supportive. And maybe those individuals that are supportive to you were part of an individual managing any mental health concerns that they may have or any mental health symptoms that they may have. Workloads are very demanding. Very demanding. Y'all work long days sometimes. There's also there's also more instances to suffer injury too. So even a slight bit of lack of focus or concentration could make an individual less safe. It also means, because you are more susceptible to injuries just by the nature of what you do, that you're more that substance abuse is that higher concern that we mentioned. If you're injured, a lot of times there is a pain medication that is prescribed to you for that injury, or maybe even to help you kind of work through the pain a little bit. And we often see that opioid abuse starts with a prescription. So that's another thing. So it's kind of very, I don't want to say it comes in stages, but it very much, one thing can impact another thing, can impact another thing. So it's not just one thing alone that can impact our mental health. It's several things that can accumulate that can impact our mental health. So let's talk about what that impact on work might look like. Anyone who is not managing their mental health, is not concentrating, not able to focus. Look at everyone. The next time you're on the job site, look at those individuals that are around you. Those are the individuals that you count on, and they count on you. You rely on each other to be able to perform your job duties, and not managing those could lead to some of these work issues like workplace performance. They can, and stressors that can impact our mental health aren't just mental health issues either, or mental health diagnosis. There are also things like relationships, what's going on at home, finding childcare. If you're providing care for an elder person, if there are financial issues, anything that impacts our concentration can impact our mental health, and it can cause attendance issues, certainly safety. Our relationships with our coworkers and our quality of work may change. And I don't want to say that anybody who demonstrates these kinds of issues has a mental health issue, but something is impacting their ability to be star performers. Something is impacting their ability to be present and be mindful and be safe at times. Now, some days, again, remember, it's not all or nothing. It's some days it's better and some days it's not. But for a lot of folks, you don't know that you're not doing well. You may not feel like you may feel like you are doing well, and you don't know that you aren't doing well until someone points it out to you. So that's why in the workplace, whenever you see a change in someone's behavior, not that you need to make all the bells and whistles go off, but to voice that concern, to say something to that person. Sometimes that's all it takes for an individual to realize, hey, you know what? I didn't realize that I was doing that. Go ahead. Let's go to the next slide, Brian. Not only can mental health impact our professional life, but it can also impact our personal life. I mentioned financial concerns. If we are having mental health issues and we're not making good decisions, it could very well impact any financial decisions we make, any issues we have in our relationship. I'm a licensed clinical social worker in Missouri, and there are a lot of marital concerns that we see, or relationship issues that we see in our counseling sessions, that started off because someone is feeling depressed or someone is feeling anxious, and they're not able to really be present with what they're doing and be all in, if you will. So it's not just in the workplace, it's also in other things. We'll see it in our sleep. We may not be sleeping well, or we may be sleeping too much. And again, we talked about performance. And those coping behaviors that we have learned to embrace maybe over a period of time to help us deal with any kind of mental health challenge, things like substance abuse, gambling, tobacco use, those aren't always, they're not the most healthy to engage in, and they can have consequences to our health as well. Physical health and being physically healthy is also has an impact on our mental health. Some of the barriers, if we bring these things if we're aware of these for ourselves, these concerns for ourselves, or we bring them to the attention of someone that we work with, someone that we work for, someone that we're there, one of our peers, is there's always going to be an excuse. There's always a barrier to seeking assistance. That can be the time. I don't have the time. How many of you have heard that? How many of you have even said that a time or two? I don't have the time. My schedule's too crazy. For some folks, they're not even aware of what benefits are available to them. And this is going to be key as we talk about what are some things you can do. There's also a stigma attached to seeking services. And one of the things that is really important, as we said in the beginning, is to really be able to think about what strategies can we put in place so that we lessen that stigma and we create a culture that says, you know what, it's okay to ask for help. It's okay to say, you know what, I'm just not having a good day. We would tell someone if we were having a headache, maybe. We would tell someone if we had a pain in our shoulder or something like that. But we're not as comfortable with saying, you know what, I'm just not feeling it today. I'm just not feeling like I can concentrate. Being able to know that about yourself, but also being able to do that in a culture that says, you know what, it's not a character flaw for you. We're not going to penalize you. It's something that can be managed, and that support from the workplace is very important. We also, a lot of times, go through denial. That's not me. I don't have that. That is not something that is in my family. That is not something, or we see it as a flaw. We minimize it. Oh, it's not that bad. Yeah, I wasn't on my A game, but it's really not that bad. It's really not that bad. But you're right. One day, 1 hour, one moment, it may not be that bad, but you may not feel that bad, but the consequences of how you feel may turn into a bigger issue if you're not feeling mentally well. And I mentioned benefit awareness. Not knowing who to call is a big barrier to seeking assistance. You have to know who to call. And it's very important that you let everyone, union and non-union and contractors, know who do we call if we need assistance? Where should we go? So some of the barrier busters, so the way that we can address those things that are barriers for us is maybe even engage spouses and domestic partners in these benefit discussions. Sometimes, especially if one member of the household is a primary breadwinner and they're working most, I don't want to say solely working, but there's usually one person in the household that takes care of all the benefit information, takes care of making all the appointments. And so making sure that that individual is aware of all and included in all the benefits discussions. Because if I am not feeling well, my spouse may be able, or my partner may be able to remind me, or even my roommate might be able to remind me, hey, you know, you have that benefit. It might be worth it to give them a call to see how they can help you maneuver through this. Educate and remind often about all benefits. That's including EAP benefits if you have them. If you're not sure who your EAP is, or if you have one, ask, find out, because the EAP is typically a free service that's available to you. And remember, it's not just about counseling. It's also about focusing on those other things, the childcare, the financial, all those other things that the parenting, all those other things that might be impacting our ability to manage what we have typically been able to manage in the past when it comes to mental health. Communicate information often. Any kind of good, supportive, proactive information that you receive about maintaining your health, taking care of yourself, maintaining your mental health, make sure that everyone is aware of that information. Everybody. Make sure that everyone, especially foremen, know about all the benefits that are available to everyone at the work site. So that may be benefits they're more familiar with and benefits that they're less familiar with, maybe through the contractors. Because if they're noticing a change in behavior on the work site that is concerning, they can then remind that contractor or remind those individuals of the benefits that are available to them. The other thing too is, as I mentioned, I may feel like I am functioning very well and not even aware of some of my changes in behavior. But if we share as a leader, as a foreman, as a peer, if we share the concerns empathetically with our coworkers, with those individuals on our teams, with those individuals in our work site about what we are seeing and our concerns for that, then that individual might even not even realize, and that may be a point of awareness for them that they need to figure out something to do. Contact one of these resources, talk to maybe someone that is already in their life that is supportive and that they are using to address what is going on with them, those symptoms, those things, so they can better manage their mental health. So let's talk a little bit more about addressing those concerning behaviors, or how to help employees who are struggling. Best practices, and again, I'm going to say this again, and I might say it a couple of times. You need to create a culture that says it's okay to ask for help. That will help lessen the stigma. Have those discussions. Give people permission to even say the words mental health. Encourage discussions, don't judge. Again, if someone is having a mental health issue, it is not a character flaw. It can be temporary as long as they manage themselves. As long as we take steps to manage ourselves, it's not going to be a permanent thing. Provide reassurance, provide resources to each other. Again, you have to know what those resources are so that you can provide them. As leaders, we need to listen. And by listening, I don't mean doing 6 things at one time. I mean, being very present with someone when they are sharing with you, being very attentive, whether that's your eye contact, your body language, maybe moving somewhere where there's some privacy. That's important too, because you want to be able to encourage those discussions, not from a judgmental standpoint, but from a standpoint of you being able to point that individual in the right direction. Don't feel like you have to have solutions. And believe me, there are no perfect solutions. It's absolutely okay to not be perfect. But if you can even just point someone in the right direction, that may be all they need to pursue whatever it is that they need to resolve anything. Education is key, just like you're doing here. You want to educate and train your leaders, your staff, especially safety managers, on different performance indicators. Again, what the resources are, different policies and processes that are in place to assist individuals who may be struggling. Encourage everyone to support each other. It's not just a leadership issue. It's, again, I'm looking at the person sitting next to me or working next to me. And if I am concerned about some of the behaviors they are demonstrating, it may be for my own safety, I'll want to mention it to them, even empathetically and with resources in hand. Work with your unions, find out what resources are available through them as well that your union employees might have. Again, knowing where you can point a person and what kind of resources you can remind them that they have. When you're speaking with a distressed employee, it's very important to pay attention to any of the changes in their behavior and to protect their privacy. As I mentioned, listen empathetically and focus on those specific behavioral or performance-related issues. You do not need to ask a lot of questions or any questions about what's going on in anyone's life. They will share with you what it is that they want you to know. You don't need it. It will make you and them very uncomfortable to ask a ton of questions. So you really, when you're having conversations with them, you want to focus on what your concerns are and the observations you have made. Don't even throw out there any attempt to diagnose, even though it's not an official diagnosis. Don't put labels. Don't say you look like you're depressed. You look like you've got, anxiety. Don't put any labels on that, because that might be very scary for that individual, and they may not be ready for anyone to assume that they have that kind of diagnosis, if you will. And of course, consult with human resources. Consult with who you need to, and including an employee assistance program if it's available. Be empathetic and maintain boundaries. Don't treat one employee any different than another, regardless of what you know. It's very, very hard when someone is sharing with you everything that is going on in their life and how it is impacting them. We tend to want to maybe give them a little grace. We tend to want to give them a little slack, if you will. Keep in mind, this will only progress if it's not addressed. Especially, behavior will only progress if it's not addressed, especially if it's going on for long periods of time. Respond to those employees' concerns so that they know they're being heard. This is about being present. This is about looking them in the eye and having those conversations with them. And we already talked about limiting the amount of personal information the employee shares. Don't ask questions. Just let them talk, let them share what it is they want you to know, and decide where you go from there. It is not your job or your role to fix them. And that's very, very important. It may be your role to just share with them where it is they can go so they can do the work that they need to feel better and to function and to feel more productive. And again, those resources, whether it's HR, an EAP, a benefits fund office, whatever it is, wherever it is, know the resources. You don't need to know them inside and out, but knowing when to point someone in those different directions is key to creating that culture of being okay. So just a few scenarios that I wanted to run through here that may resonate with you is, when you see someone demonstrating anger, don't assume, again, this is that diagnosis piece, don't assume they have an anger management problem. Anger management goes much deeper than one anger outburst. Keep in mind, if anyone has challenges, whether they're mental health challenges, personal challenges, whatever's going on, we all show the impact of that in different behaviors. For some of us, it may come out as anger. For others, it may come out as sadness. For others, it may come out as a isolating. But if you do notice that change in behavior, making it that statement, I noticed you've been yelling a lot lately. That is enough. You're not asking any questions here. You're pointing out that you've noticed this change in this person. Again, it may create enough awareness in them that they will make the changes that they need, or realize that, oh, I am off. Something's off. Maybe I'm not sleeping well. And then having those resources to point them in the good direction. Attendance, that's a big issue. That's where a lot of things come out. Don't say, I've noticed you've been having trouble getting to work on time, or you're having problems at home. You don't want to go there, because again, don't ask those questions. It could be viewed as prying. It could be viewed as somebody really closing off and not even talking at all anymore. So that the way you answer these are also what creates a culture that says it's okay. Maybe it's more, I notice you've been having trouble getting to work on time. That's not typical for you. And they will share with you what it is that they want you to know. And then that last one that usually throwing things, which may also show anger. It also shows irritability. It also shows diminished patience. So reminding people that it is important to work safe. I understand you threw your tool yesterday. You know that that's not that it's important to work very safely. And remember, we have an EAP, or remember, you have a benefit that's available to you. You have a resource that's available to you. You don't want to come at that person forcefully by saying, throwing things is not allowed. You know that. I can't believe you did that. Snap out of it. It's not easy for someone who is managing their mental health to snap out of it. It just doesn't work that way. So to be able to be empathetic, but yet maintain boundaries by some of these responses will be encouraging. Unfortunately, mental health concerns do bring about suicidality at times. So it's very important that we recognize this and how we can respond to it. Some of the myths that I want to dispel, or facts that I want to point out about suicide, is that talking about suicide will give a person the idea of doing it if they never had it. This is completely false. This is a myth. You are not going to plant the idea of suicide in someone's head by asking. If there are concerning behaviors, you need to ask so you know what steps you should take to keep this individual and everyone around them safe. Suicide is not an act of aggression, anger, or revenge. It may seem like it because of the triggering events, but it's not that. It is not that. Typically, people are very passive. Typically, people are in such a compromised state emotionally that this isn't an act of aggression for them. And people who talk about suicide are just trying to get attention. It may seem like that at times, and people may say, oh, I was just kidding, or, oh, it got you to look, didn't it? It got you to talk to me, didn't it? You need to take any statements about self-harm or harming anyone else very, very seriously, because the fact of the matter is you don't know what is something that someone is actually going to act on, or what is something that they are just feeling in that moment, and it is very fleeting. The other thing is, suicidal people do not want to die. The fact that stating that they want to die is a myth. They don't want to die. They just want their pain to stop. And they feel like they don't have any options other than suicide. So if we look at what the warning signs are, The things that would of someone who may be compromised or may be having some suicidal thoughts are those dramatic mood changes. So 1 minute they're up, the next minute they're down. 1 minute they're engaging, the next minute they're isolating. Very dramatic mood changes. Reckless or risky behavior, which you're probably going to notice on the work site because it impacts safety for everybody. And certainly these behaviors are things that you want to address, but also someone sharing with you behaviors when they're not at work that might be risky or that might be reckless. Anyone that you're aware of or shares with you any increased substance use could be an indicator. Again, not that anyone has any of these warning signs that they are suicidal, but these are things to look out for, and to be thinking that this could be, the suicidality could be a reason that they're demonstrating those negative changes in workplace, certainly expressing feelings of helplessness and hopelessness. Remember, someone who is suicidal is feeling hopeless. They're feeling helpless. They feel like they don't have any options. That may come out as an increase in anger or rage, or again, those changes in behavior. And certainly any threats of anyone says of harming themselves or anyone else, even if it doesn't seem serious, you want to take seriously. So what do I do? What do I do if I see those warning signs? Ask that individual, the employee, your friend, your family member, whoever it is, ask if they are having suicidal thoughts. It's a tough question to ask, and it's a tough word to say, suicide. If you ask them, you are showing concern. You are showing that you care about them. The thing about asking is you have to be prepared for what you're going to do if they say yes. So having those resources, having that action plan, if you will, having your response together so that being aware of what it's going to be, your response might be if that person says yes. You want to be prepared. You want that to be in your toolkit. If you're not sure what to do, if you're not sure how to respond, if someone says yes, you need to educate yourself about what that looks like. Talk to people in your life. Call your EAP if you have one, ask them. Call a friend, a family member, call the National Suicide Prevention Hotline. Call who you need to so you know the appropriate way to respond. If someone says yes, you want to plan to try to get the employee's agreement to get help. And that doesn't need to be, that can be as simple as, I need you to work with me to call someone so that you're not by yourself. Again, use those resources that you have available to you and know what they are if someone says they have a plan. Arrange help. If urgent, call 911. Find out what policies and protocols are at the work site so you know what to do first. Do I call 911 first, or do I have to call someone else? The other thing is when you have these conversations with people, it can impact us individually. It can impact our well-being. It can impact our emotional health. And mental health. So self-care is very, very, very important. So if you need to talk to someone after you've had conversations with someone, so you can kind of debrief and process through what just happened in that conversation, that is part of your self-care as well. Go ahead, Brian. These are the resources for National Resources for Suicide Prevention. And I encourage you to make note of these resources so that you have them. These are some of those items that you can have in your toolkit for yourself, but also for some of your peers, coworkers, those folks that you're closest to, those folks that you're around. These are things, if you have an EAP, get that phone number and add it to the list because they're available 24/7 also. And you always want to call 911 for an emergency. Always, always. Go ahead, Brian. Okay, that is all the information I had. So I know I gave you a lot of information in that last 40 minutes, but I also want to allow time for questions. So does anybody have any questions, concerns, anything that needs to be clarified?
Lisa, I have a question.
Yeah.
let's say I'm on a job site and, trying to lessen this taboo of construction workers, not necessarily having feelings, or portraying that they don't have feelings. And I notice something's off about a colleague or a coworker, and I try to approach them, and it just, like you had mentioned, it's total denial, but I have concerns, and I'm not a boss. I'm a journeyman wireman. What would my steps be to go to my foreman, and do I call one of these hotlines? What's the best step for the person that's just a journeyman wireman or a journeyman lineman? They're not necessarily have a leadership title on the job site, but they notice something's off about a colleague. How can I be sure by going to my foreman that the foreman is going to be empathetic to this person's needs?
That's a very, very, very good question. And I think some of that will come in training with the foreman, but you do have to trust. You have to be able to trust that the person you're going to is going to be able to take action. And we don't know exactly what that action's going to be. So it might be that you have a conversation. Maybe remember that communication is very key. So the foreman can educate everybody about what they will do. If when you go to them, you can ask, what are the next steps? So if you're going expressing concern about some behaviors that you saw in a coworker, if you're going to that foreman, you're expressing those concerns, you're sharing with them maybe the conversation that you had with that individual, you need to know what that foreman's next steps are. Ask what that foreman's next steps are. If that individual that you are talking to denies, oh no, I'm fine, it's absolutely okay to say to that person, well, I noticed that, and I know we have a lot of resources available, so if you want them, I can share them with you. Or feel free, you can check with the foreman or look on a job site board or something like that, and I know we have information there. So you want to be able to share with them where they can go. Chances are very good that they're going to be in denial because they didn't realize that what they were experiencing was so observable. So if that individual, by creating that awareness in that individual, if it prompts them to take some steps on their own, that's fine. That's exactly what you wanted them to do. Now, I will say, if you are noticing them doing something that is a safety issue, that's a whole other game. You definitely want to report that immediately to the foreman or follow whatever the policies and the protocols are so that safety issue can get addressed. If that peer or that worker shares with the foreman at that point that they have something going on, then the foreman will be able to take the steps that they need to take. Certainly, if someone shares with you that they are suicidal, you don't want to leave that person alone. You want to be with them. How you can be empathetic is say, let's go talk to the foreman. Let's go. I'm concerned about you working. I'm concerned. You can even say, I'm concerned about my safety and your safety. Let's go see what our options are. And you can go with them, be with them as long as they want you to. So, that was a long answer, but it depends on where they are with things. But ultimately, when you go to the foreman, you need to be able to ask, what are you going to do? What are the next steps that you're going to take? So I can feel comfortable with working side by side with this person too.
Well, and if I could add to that.
Okay.
Sorry. No, if I could add to that, I mean, I think it's somewhat more the same, but this conversation really is for contractors determining how they're going to address exactly that question. And a lot of trades contractors that I've worked with, they rely heavily on the safety manager. And so, because that safety manager impacts the conversation, but for each contractor, decide how you get that message out, and toolbox talks are a great way to do that. But, how do we communicate what benefits are available and get them out to folks? The other thing that I'll say is that these guys usually, they do tend to be a little bit more reserved and not, want to ask for help. So the more often you can communicate what benefits are available, the better. Because one of the things about mental health, it's like any other disease or condition, it can start really small, and the quicker you catch it small, the more you're likely to avoid expenses or loss of an employee, or, lack of attendance down the line.
Nobody wants a safety issue either. Nobody wants an accident.
Right.
Nobody wants anyone to be hurt.
Thank
Any
you.
other questions? Sure. Any other questions?
If anyone has questions following this, Lisa, what's the best way they could reach out, or Todd or Dave, to reach out to you personally to perhaps continue a conversation that they might be dealing with?
We can,
We can pass, yeah, we can coordinate with you to pass around contact information. Obviously, Lisa and Brian have some of their contact information right here, but we can make sure that gets distributed along with the recording of this talk here today. And I know Lisa and Brian, as well as Dave Ragg, certainly be happy to talk to anyone at any level of this conversation.
Great. Well, oh, go ahead.
I wanted to add just some of the things that we see on the benefit side with our clients, and that we're often looking at aggregate claims data, and every time we look at it, mental health issues are near the top of the list of issues that we're seeing. They're driving a lot of the costs. I'll just give you a quick example of comorbidities that happen within a workplace, where you may have somebody that's diabetic, and we all know that if they're not taking care of themselves, they can end up in the hospital. And so when you start to unpack somebody's issues and what's going on in their life, you find out, well, yes, they ended up in the hospital 3 times in the last 6 months. You find out that they were not taking their medication, they were not testing as they should. And then you start asking more questions, where they start sharing information that said, well, the reason I'm not doing that is because I can't afford the testing equipment, I can't afford the medication. And then you talk a little bit more and you find out that they're going through a divorce and so forth. So it can become pretty revealing to have these types of conversations. And I know it is hard for organizations, especially ones that are male dominated, to figure out, how do we get somebody help? What are the right questions? And I do think making that connection has to be as easy as possible. So for organizations that have certainly a medical benefit that has mental health, substance abuse care attached to it, that is good. But when we're looking for a doctor, whether that's a specialist or even just a primary care doctor, we all know in today's world, it is difficult to get an appointment, right? So having the ability to just call somebody and get immediate help is extremely important in today's world. And my one question to you, Lisa and Brian, is that when somebody calls your organization, how do you unpack what's going on in their life when they call you, to really find out what is going on, and how do we get them help?
So for us within our organization, we have counselors that answer in our call center 24/7, 365. So what they do is, when someone calls, is they are assessing what is going on with that individual. They are asking those questions. They are asking questions that will help them determine what the best next steps are, because that individual calling is the first step. That is the first step, them calling. So the fact that they've called has already started them on a path of making some changes or addressing the things that they are viewing as obstacles or barriers or the challenges, whatever the case may be. So what our counselors do is we talk about what is going on, what's prompted you to give us a call today. That is one of the big questions that we ask. What has prompted you to give us a call today? The other thing you have to remember, and we will address those, put an action plan in place with that individual right from that moment, whether it's using one of our services or several of our services, or if that individual is suicidal and they need to get attention more than what we can provide, then we assist them and we stay with them and keep them, if you will, until we can make sure that they are safe. So that may mean calling a family member. That may mean, having a coworker take them to the hospital if it's needed, whatever is going on. But calling is the first step, and you can't put too much on someone when they make that first call. So we're not taking really deep dives. We're addressing what has prompted them to call. And then when they are connected with the services, whether that's seeing a counselor in person, virtually, talking to them on the phone, it could be that they decide they want to call back later in that day too, to have another conversation. That's fine too. Whatever it is that they're willing to do, we can work with them to determine what's the next step we can take. What's the next step we can take? Not every concern results in needing medication. Not every concern results in needing something real intensive or real extreme, or in the case of EAP, it doesn't even impact the pocketbook because it's free of charge. So listening to where that individual is, what's prompted them to make the call, and responding to that. The rest of it is, you might have heard the analogy, it's like an onion. So when they get involved, when someone gets involved with services, we start peeling back the onion a little bit then. Now, with that said, if someone wants to share and someone wants to just talk until they are tired of talking and they want to share everything, counselors are really, really good listeners too. So that's what mode we're in then. And then we, talk then we say, what's the priority? We help that individual determine, what do we address first? Because we can't address it all because that's too overwhelming. And you always want to set someone up for success, not failure. And setting them up for failure would be overwhelming them with even more options and more resources. So handing someone a list, or just giving them a list of, okay, these are the people you need to call all of them to see who's available, or, call all these places. That's overwhelming them. It's not setting them up for success.
Great.
Does that
And
help?
I would add to that a couple of things. Oh, I'm sorry, Lisa.
No, go ahead, Brian.
Jumped on.
No, go ahead.
One other thing that's worth noting is, while we don't want to overwhelm them, we also have a significant suite of services that we offer to help manage life's challenges. So in addition to counseling, we also have elder care services and child care services, and just different coaching, healthcare coaching, tobacco cessation. So we provide a lot of additional services that may be connected to the issue they're having. I think
Right.
Lisa said something similar, but we'll get people calling in that have trouble with their relationship. And, oh yeah, you could use couples counseling. You could also use a little financial consultation because you guys are fighting over money. So get them up with financial consultation.
Right. Right.
The other thing that I'll note, I mentioned earlier that catching it early is helpful. These small stressors can add to larger stressors. The other issue from a cost perspective is, if all you have is a hammer, everything looks like a nail. If somebody is depressed or anxious and goes to their general practitioner, that general practitioner is likely to write a script for a antidepressant or anti-anxietal, and that script will be there as an expense for a long time. That doesn't mean that we're saying that those are bad, or that we're not taking over the responsibility for whether they need that antidepressant or not, but they could be well served by face-to-face counseling before they get to the point where they're taking a prescribed drug.
Mm-hmm.
Great. Well, listen, thank you so much, Lisa, Brian, Dave, Todd, for sharing your expertise with us here this morning and bringing a topic that can be uncomfortable and most people might want to shy away from to the forefront, and making it okay to ask for help. Again, thank you to all our participants for signing on here this morning. It's greatly appreciated. The next Industry Hour series will be July 29th at 9 a.m. and it'll be DeWalt Concrete and Anchor Solutions. So we'll certainly look forward to that. I will be sending out a brief survey. If everyone wouldn't mind just taking a few moments to fill that out, it's greatly appreciated. And have a wonderful day, everybody. Thank you so much for your time.
Take
Thanks,
care.
everybody.
Thank you, everyone.
Bye.
Yeah.